Find out what one local organization is doing to guard your heart. Coming up, how to reduce your risk of heart disease. It's about lifestyle choices, how eating, exercising, and even what you think can impact your heart health. The Aware Show starts right now.
This original WSRE presentation is made possible by viewers like you. Thank you.
Hi, I'm Dee Dee Sharp, and welcome to The Aware Show. We're glad to have you right there with us. Heart disease is most often associated with men, but it's actually a leading cause of death in men and women. About 610,000 people die of heart disease in the United States each year. That's 1 in 4 deaths. And Black Americans are at an even higher risk of cardiovascular disease and stroke than white Americans. And as you look at these statistics provided by the Centers for Disease Control, you can see what we're talking about here. Black women at 49%, Black men 44%, white men 37%, and white women 32%. Now, one local organization works diligently to raise awareness of this problem. The Links Incorporated Pensacola chapter, a group of civic-minded professional women, hosts their annual Red Dress event in February. They invite a panel of heart health experts to educate the community on matters of the heart. It's a real crowd pleaser to the Go Red event. Proceeds for Links Red Dress Jazz Brunch go to benefit a local scholarship fund and to support the American Heart Association. And joining us in the studio now to tell us more about the Links Incorporated and their panel discussion for Go Red, the Red Dress event, is this lady, none other than Dr. Laurel W. Boyd, registered nurse. And of course, we have some of the panel guests here to share information with you about heart health. Our guests include Dr. Brent Vidal, cardiologist, Baptist Healthcare. Also, we have Alberto Cruz, clinical dietitian with Baptist Hospital, and Dr. Kia Wiggins, licensed clinical psychologist and a professor at UWF. Thank you goes out to each and every last one of you for joining us here.
Thank you for having us.
We're glad to have you here because we've got a lot of great information to share with our viewers about how to protect their heart. And we're going to start with you, Dr. Boyd, because one of the reasons why we wanted to do this show was we heard a lot of rave reviews about what you all do with the Links Incorporated in your Go Red Jazz Brunch with all the ladies in red participating to benefit the American Heart Association.
Well, Dee Dee, it's quite a pleasure to be here. I do appreciate all of the activities with the Aware Show. The Pensacola chapter of the Links Incorporated was established in 1972 here in Pensacola. It is part of the international organization, Links Incorporated. Over 15,000 women of color who are engaged in all the professions. And actually, our most recent chapter was organized in London. So we are around the world. Not in Asia, I don't think, though. But back to the question at hand, the Go Red for Heart Health Jazz Brunch began back in 2012, and we partner with Baptist Cardiology Consultant, and they, with Boston Scientific, have worked with us on this project. And as you said, each year a scholarship is given from the funds that are generated, as well as some funds are contributed to the Heart Association.
Mm-hmm. Well, we appreciate all that the Links Incorporated do. We could talk about a lot of different things that you all do in the community, but we're zooming in and focusing on this one because, as I mentioned, a lot of rave reviews about what you all do for heart health and this particular panel. And the interesting thing about doing the Aware Show on this is that a lot of the questions that I'm going to actually ask our panelists were actually generated from audiences that you all have had since you've started this a few years ago. So thank you for that, and thank you for this. And here we go with what we have for you here on the show. Dr. Vidal, we're going to start with you. We're so elated to have you come and talk to us about, talk to us about heart health because, I mean, without it, what would we do? We wouldn't.
Right.
So a little bit about heart health in general and the statistics that we shared with our viewers up top. Alarming numbers for
Yeah.
Americans overall, for
Right.
women and for African Americans.
Right. So there's always been a gap. For early part of my career, it was with women, but now it's minorities. And we're trying to bridge the gap of everybody being equally educated, equally access to treatment for heart disease. Just some statistics that will shock you. Many women focus on breast cancer. Right now in the United States, there are 3 million women who have breast cancer. 1 in 31 will die of that disease. For heart disease, which we include stroke, 50 million, and 1 in 3 will die. So that's the shocking statistics of why the message is to get out to women and minorities to treat themselves, to see doctors, to educate themselves about heart disease.
I'm so glad you shared that, because even in all the research that I've read to put the show together, didn't know that. Those are alarming numbers. Just like,
Right.
yeah. So all the more reason to do this unaware and try to educate our viewers, because as we'll be talking about in a minute, we know that this also has to do with their diets. This also has to do with the way we think. And you said something in the green room before we even got started that was like off the pages to me. And I was like, that's really good. And we need to let people know that too, is that this isn't just about your being African American. This is also about where you live. I mean, it's not just about genetics, it's about your zip code.
Right. So it's either the nature or nurture. Nature is, are we built, are some of us different? Do we have a genetic code? There is some scientists that believe that Africans living in Africa actually are more salt sensitive genetically to survive the heat. They retain more salt. Because the biggest risk factor for heart disease is blood pressure. So there is some genetic data out there, but by and far, it's not your genetic code, it's your zip code. It's where you live. I think you brought it up. It's access to mental health facilities, to gyms, to food. I just saw last week that Tallahassee, a group of students put together a little ice cream truck that's going to neighborhoods delivering not ice cream, fresh vegetables.
Good for them.
Yes.
Is that an awesome idea?
That
But
is
you know,
good.
the point is that we live in an area of the country, they call it the Bible Belt. Well, we're the stroke belt and heart belt. If you look at the CDC, and the reason is because our diet is high in processed foods and saturated fats, and we are socioeconomically challenged in this area. We don't have access to some of the things that people do in larger cities.
Very good. And Dr. Wiggins, you talked about that, as Dr.
Yeah.
Vido said back in the green room before we came out, and just keeping with this, not genetics necessarily, but the zip code. Can you just kind of expound on that? And then we want to get Eddie in here, because all of this is going to point to diet.
Right. Yeah, I think
Thanks,
diet is a major role. And as a clinician, I'm always pretty vigilant about asking my clients what they're eating, even though I'm not a dietitian or a nutritionist. I'm aware that a person's mood can be highly impacted by the types of food that they consume and the times of day they're consuming certain types of food. So if for breakfast someone's having Pop-Tarts and Sprite, which I've had clients where that's their diet, and they're talking about feeling lethargic or having difficulty concentrating on things or just not wanting to get out of bed, I'd be amiss to just focus on these depressive symptoms without acknowledging the impact that their diet might have on their mood or their ability to function. So when someone is diagnosed with depression, a lot of times they're prescribed an SSRI. And so, the theory is that, their serotonin is being dysregulated in their brain and they need a drug to regulate their serotonin. Well, there's neurotransmitters in your stomach as well. And so it's important to pay attention. And they're not taking pills for their stomach, they're just taking pills for their brain, right? So it's important to acknowledge that what you eat is going to impact how you feel throughout the day. And we talked about like food deserts and people living in certain communities where they don't have access to whole foods. And, we tell people, well, go to the grocery store and buy vegetables. And for some people in, some communities, that's not a challenge. And for others, they live on streets where there's one Popeyes, one Taco Bell, one fast food restaurant after another, and it's cheaper for them theoretically.
Not to mention
not
it's
long
good.
term.
I mean, it tastes good.
I mean, I hear this a lot from clients too. It's so much cheaper to go to Taco Bell. Well, not not in terms of your healthcare costs later on down the line. You have to pay for that later on in life. But, it's cheaper and it's convenient, so that's what they do. And so I think that zip code has a lot to do with that.
And not just, we talked about too, not just picking on any fast food or
Right.
anything like
Yeah.
that, but also having access to gyms and the other things that we know that would be helpful to us in being healthy.
Or, having a broader understanding of what it means to be physically healthy. So if people are living paycheck to paycheck, then telling them to go to the gym is probably not a realistic solution. But having them be more active throughout the day, we talked about this in the green room, walking a little bit, parking a little bit further away from the grocery store, incorporating walking up the stairs instead of taking the elevator, watching what you're eating, not eating, a whole bunch of processed foods. Those are things that are pretty easy to implement in your daily, habits.
Gotcha. And that brings us to you, because we started off in the green room with you, and it was like all the questions came right over here, and it had something to do with diet. And so that's why we wanted to have you here as a part of the panel, because that's what the Links tries to do as well. Because diet and our nutrition is very essential to the bigger picture of heart health. And so tell us a little bit about some of the issues we're talking about with African Americans, the high numbers there with heart disease and stroke, and tell us what do we see and what do you see in the numbers and how that impacts with our diets.
So Dr. Vido made a great point of how minorities are very affected by this. Dr. Wiggins mentioned the food deserts, which is a very big problem here. And I did like Dr. Wiggins pointing out how we have all these fast foods right next to where we are, and there's no area where we can just kind of walk. And even, not looking at a gym, just getting out, doing some physical activities, it's a little bit hard. And you mentioned the zip code, Dr. Vido, as well, and that is extremely vital, extremely. And then you mentioned education as well, which is very hard to bring to these people, especially when they're socioeconomically challenged. And as health professionals, we have to sometimes do outreach to the community and stuff like that to kind of help out, because sometimes when they come to us, and mental health, cardiology, when they come to you, it's, we already have the disease, we already have heart disease, we already have hypertension. So we're not very proactive or about it, which we definitely should. People just kind of discredit their diet and don't focus much on it. And having Dr. Wiggins here and speaking about mental health, especially in this country, and how underfunded so much of mental health is, I think it's very vital for us to kind of incorporate this wholesome general approach and take all these different ideas and kind of incorporate into our daily lives. You mentioned our physical activities, our diet, how that changes, and you mentioned it's hard for someone living paycheck to paycheck to go out and buy these fresh fruit and veggies. So we kind of have to provide, as health professionals, different alternatives to these people. We just can't say, well, if you can't afford it, then you can't afford to be healthy. That is not an option. We have to find ways to be helpful to these people.
And then the other thing to it, I think it's a even big picture in this thing is, not only are you at that kind of disadvantage that we're talking about, but you're also at a disadvantage of just not going. I mean, if you don't have health insurance, you're not going to go to the doctor. If you've been taught stigmas with mental health, you're not going to go to a mental health specialist. And by the time we get to a cardiologist, we're already addressing some serious issue. And then diet, if we're going to go to just right around the corner and get something that's not as healthy, that's cheaper, as opposed to a few miles down the road to a healthier place to get some fresh fruits and vegetables, then we're in a cycle. And it does become more the zip code.
And I just want to add, because you've mentioned, these numbers in women, and they're really alarming. And I do think that women in general, there's something about the way that we're socialized in regard to being caretakers. And there's something about being a caretaker that when you're always oriented toward perceiving other people's needs, that when it comes to you having to perceive your own needs, what is my body saying to me? Am I tired? Or, whatever the case may be, we're not as perceptive at times of what we need. And so I think it's difficult for women sometimes to be able to not only, assert their needs at times, but even be able to identify what they
Right.
need. So I do think that sometimes there's this mental shift that we have to engage in as women, where we, allow ourselves to release ourselves from the bondage of guilt for focusing on what our needs are, and taking the whole, you have to take care of yourself before you can really that's a real thing. You can't really be 100% for someone else if you're ignoring your own needs.
I'm loving that. Anything from over here?
Yeah, well, I would just say number one is for medical access, you're right. That's a big problem. That's beyond the scope of the show, but that's what the whole debate in Washington is.
Yeah.
But you know what? In Pensacola, we are blessed to have many church communities, Baptist church, Catholic church, I think Methodist church, have clinics. We have a Escambia County clinic. We have a public health. We have access for people to go get their blood pressure checked. Because here's another statistic. Black Americans are 77% higher rate of diabetes. So diabetes, hypertension, but it affects everybody.
Right.
Whites, blacks, Hispanics, Native Americans have a terrible rate of diabetes. We have access here. You should get it checked. And what your viewers need to know is that most of the medications to treat high blood pressure now are $4. So that's an access. I wanted to bring up, Dr. Boyd, that Boston Scientific, one of the companies that works
Right.
with you, I think they're moving, Dr. Cruz, they actually going into high schools. And Dee Dee, they're teaching the kids.
Good.
They're going to the kids and they're telling them about diet. Because, if you've seen our high school kids eat, it's terrible. They're out in the field, they're slim like this,
Yeah,
but they're eating chicken fingers and macaroni and cheese.
Right.
But they've got to go home to the family and say, no, we should be eating fish. I think that education's starting at a younger and younger age. Would you agree?
Oh, yes. In fact, one of the projects that the Pensacola Lynx had several years ago, for several years, was working with elementary school children in the Boys and Girls Club over a period of a year, bringing foods, teaching them how to cook certain things, and promoting even personal gardening. But the earlier it starts, that habit, we talked about a habit takes a long time to establish.
Yeah.
It does.
The earlier it starts and the better understanding.
Right.
All right.
Yes, I just
Yeah,
want to
go
add,
ahead.
Dr. Vido mentioned how these kids are getting this education now and they get their meals at school. And I'm Hispanic, it's a poor community. I was born and raised in Puerto Rico. And a lot of times these kids, that's all they get to eat. They come home,
Right.
and
I
that's
know.
it, it's over, So summer is a bit of a drag for them in that
Right.
case. So it's very important for us to educate them there and kind of start off early so they understand how important it is, because sometimes you get these meals and they're not really, really healthy. They're not what you're looking for, but that's all they have. That's all they're going to get. So it's important for us to educate, jump in, and let them know, hey, this can get better. We can improve this. We have to work upon it, but it can get better.
Right.
Then there is there's other layer of psychological factors, because there is a diagnostic indicator in the DSM-5 called psychological factors that affect a medical condition. And so sometimes people have type 2 diabetes, and I see them in session and we're working on their depression or their relationships or whatever. And when I ask them what they're eating pizza, they're eating processed food, and they know that at some point they're going to have some negative health effect from doing this, but it's down the road. So they don't have the neuropathy yet. They don't have the vision problems yet. And so they're able to be in this position of denial, where because there's no direct consequence right now, then they continue to do things that they know that are harmful to themselves. So we have to work on that in therapy, in a therapeutic setting, to address the denial that no, this is something that you're really doing to yourself. And even if you don't have the symptom today, you're on your way to having that symptom, and it's really serious. And sometimes people, they don't recognize that. They're able to be in a position of denial.
I love that a lot.
Dr. Wiggins brings up a very good point about denial, because it's like it'll be down the road.
Yes,
and
yeah.
I mean, we can speak about how patients have a disease and they just know, I'm in total denial. That's not what I need to eat. That is not me. I do not have diabetes. I do not have heart disease. I have a very good heart. And it's very, mental health has a huge
That's a psychological
exactly
issue.
has a huge part to play in that.
Right.
And it's very important that you bring that up, because it's something that we need to kind of work better at, really. And since not having psychologists and bringing in and talking to these patients would be very helpful to them, actually.
Right. Yeah. There's a reason why people are in denial, and it's, to save themselves from the discomfort of the reality of what's happening in this moment. And when they're not challenged to get out of that space, then they could end up doing something that's potentially very harmful to themselves.
Good stuff. I want to turn to you, Dr. Vidal, and start talking about some of the symptoms that we see. We can also talk about some of the factors that are involved with putting us at risk, and we definitely want to talk about treatment.
Sure.
So let's just start from the very basics. So
Okay.
what's going to be some of the risk factors here?
All right. Well,
involved?
the risk factors, hopefully all the listeners and all the panelists know about the risk factors, but tobacco in any form is a huge risk factor. And I say in any form because we are seeing a lot of vaping, e-cigarettes. People somehow think that's not harmful. Smokeless tobacco, any form of tobacco. Cannabis even, or marijuana, has some risk. That's a number one risk factor. Diabetes is a number two risk factor. And when you combine them, it doesn't just double your risk, it quadruples your risk. Smoking and having diabetes quadruples your risk. Lack of exercise, being sedentary. High blood pressure. And high blood pressure is defined, I think all of us know a normal blood pressure is 120/80, but actually a blood pressure above 140/90 for many people would be a baseline, high blood pressure. I think having high cholesterol. I think we've all heard about cholesterol. Unfortunately, in the 80s and the 90s, all the food industries promoted low fat.
Right.
And what they did was they filled us with sugar.
Yes.
I'm sure you could talk a ton about that.
Yeah.
But it's a whole reversal of ship. We were all taught wrong. We were eating, you'd go to the store and it'd say low fat, but it was full of processed sugar. And so that is all reversing now. And Dr. Cruz could really educate us on that. So I think those are the main things: sedentary, smoking, diabetes. You notice I didn't mention genetics because number one, here's one of my favorite lines from a professor. Genetics builds a gun, but you pull the trigger. You can't do anything about your genetics, but it's your environment. Again, we're going to that environment. It's what you do that determines your risk.
Okay. I want to pull up on
Yeah.
the screen some of the information that we also want to kind of add to what you're talking about, Dr. Vidal, that we found out about risk factors as we did a little research as well. Diabetes, you just mentioned. Mental stress and depression, which is why we've got Dr. Wiggins over here. Smoking, inactivity, menopause, and also broken heart syndrome kind of jumped out at me.
Yeah, so that goes with depression, and we've seen this a lot. We actually thought it was rare. It has a strange name, by the way. In medicine, that's called takotsubo. It's named after a Japanese octopus trap because the heart suddenly stops and it becomes shaped. I wish I had a board to draw it, but it becomes shaped like this Japanese octopus trap. People that have witnessed trauma, like seeing a child killed or their spouse killed, can suddenly collapse.
Wow.
It's very sad. If we can get them through it, if you get to the hospital, almost 100% survive. But that is broken heart syndrome. It doesn't only have to happen after you see something terrible. If you mentioned that you had been through a car accident,
yes.
To bring that up, but
Yes.
something very traumatic can trigger us. The theory is that you're releasing so much adrenaline, your blood vessels are spasming. The menopause, obviously premature menopause, and maybe we'll talk about estrogen later, but premature menopause, if you end up having menopause at an early age, you are at risk, okay? Either surgical or natural.
And what about, we had also something about chemo and radiation therapy with
Thanks for
working with
bringing that
cancer.
up.
Yeah, that was up on the screen. Tell us a little bit about the risk.
So there's a whole field of cardiology now devoted to cancer. You want to survive from your cancer, but breast cancer in particular, if you get radiation to your chest for lymphoma or breast cancer and you get chemotherapy, not immediately, but 5 to 10 years later, you're at risk for having blockages in your blood vessels. You need to be screened. That's the current recommendations. So many doctors don't know this or follow this. If you've had radiation and chemotherapy 5 to 10 years later, you should undergo see a cardiologist or your primary care.
Why does that happen?
Well, radiation can damage the blood vessels. We've gotten a lot in chemotherapy. The drugs that they use are called, it's a particular class called anthracyclines. It can actually affect the heart muscle.
Okay.
And some of the newer drugs can also affect the heart muscle.
Gotcha. Let's talk about some of the symptoms, and then we want to get to what we can do to prevent some of this stuff from happening. So
Okay.
maybe we can
So
talk, so we can make our viewers aware of what they can be looking out
Right.
for.
And so I think everybody is aware that women do not present the same way as men.
Okay.
Females do not come in like on TV where they can, but they don't have to. Clutching their chest, this is called Levine sign. You can come in with jaw pain, shoulder pain. I've seen somebody diagnosed with tennis elbow. Turned out to be a massive heart attack.
Oh my goodness.
Yes. Shortness of breath is the most common symptom. And here's the problem. All of us have these symptoms, right?
I was going to say, I have this with
I know,
stress issues.
right.
Yeah.
So
Scary.
it's more of a reason why you want to be active. And when I say active, I mean walking. Because if you're walking or you walk the dog, and then all of a sudden you start walking the dog and you're short of breath after 2 blocks, you know something's wrong. But if you're not active, your body doesn't alert you. So the symptoms are sweating, jaw pain, arm pain, back pain, chest pain, racing heart, feeling dizzy. Unfortunately, anything like that can be a left arm numbness. Those are some of the symptoms.
Okay. I have a kind of a unique situation, just saying, since I had all these experts on the panel, I can talk about me. It's kind of a cycle, because in dealing with post-traumatic stress, stress, either happy or extreme sad, can impact the body, and it does. And then trying to exercise, and I'm exercising, breathing and that kind of thing can give me a headache because it's causing stress. So I'm not looking for an excuse. I'm just telling you my truth. That
Right.
it's almost like being, okay, I know I got to move and I got to exercise, I got to do this stuff. I just got to do it really in moderation. I mean, everything, it seems to me, in this life is moderation. It's key to everything.
And
Go
Dr.
ahead,
Boyd,
please.
the Mayo Clinic has a statement. It says, just start and do
Okay.
10 minutes. I think all of us think we have to go to the gym. We're going to get so fatigued out. They say just start.
Just start.
And if you can do 10 minutes, but the next week try to do 15 minutes. You know, I think it's that guys have a tough time with this, just getting that first time, right?
The hardest part about going to the gym is getting
Going
to the
to
gym.
the
Yes,
gym.
I'm
definitely.
sorry, Dr. Boyd.
I love that. So what we're going to keep coming back to is, of course, talking about me with the mental issues that we can have sometimes that can parlay into physical issues, and of course not eating right. And
Right.
those go hand in hand.
Yeah.
Guilty. And I'll tell you a big problem for me. The first thing I have to start thinking about is when I'm not feeling 100, really well, is my water intake and how that. I mean, because we really don't think about that either.
Yeah, you
That's
could
so
just be
vital. It could
dehydrated.
just be dehydration.
Yeah.
So when we talk about some of these risk factors and that sort of thing, how much of this has anything to do with diet or I know with mental health? We talk about stress.
Right.
So either
Yeah.
of you.
I mean, there's areas in your brain that cannot distinguish between physical pain and emotional pain. The same areas of your brain will light up. And so I think sometimes people are very quick to repress emotional pain, thinking that they're saving themselves from the burden of acknowledging whatever the trauma was, whatever the loss or abandonment was. And all they're doing is storing this psychological pain that can manifest itself eventually in physical pain. So, it could be anger is very bad for your heart, for instance. There's research to support that, So, and some people, whenever they repress sadness or hurt, it manifests itself in anger. And so they don't realize that, this temporary solution is not working for the long-term problem. They probably need to go back and actually address whatever the original trauma was so they can release themselves from the oppression of being depressed, angry, sad, and having to be that way every day. So I have clients that come into therapy like, I don't want to feel my feelings. I don't want to talk about that stuff. That's in the past. I don't want to talk about the past. But they're not functioning people. There's a reason why, they're in my office because they're struggling, and they, if they were to address this pain in a way that's therapeutic, it doesn't rule their lives anymore. It releases them from that pain. Yeah.
Before we move into the nutritional aspect, the comment you made a bit earlier regarding not only trauma that's bad, but good things that occur, the stress level is just as high if there is a series of events, all of which are wonderful, and there's a scale. If you've had X number of things occur in the year, and all of them could be good. Did you get a new job? Did you get married? Did you have a baby that you were expecting and wanted?
Right.
Did you graduate from college? All of those things, those accumulate too to increase the stress level. And people with a lot of things happening, oh gosh, she had so many good things happening to her. Why is she in difficulty, or he?
Right. There are transitions, though, when you go through a huge life transition, even when it's positive.
Exactly.
Sometimes you have to figure this new version of yourself out. It's like you really wanted to be a mom, but you've never been a mom before. So when you're a mom, it's like, well, I don't know how to be a mom. So there's like all of these positive aspects to it, but it can also be very scary as
And
well.
all of them add to stress,
Right.
which has an impact on the heart.
I'm so glad that you said that, because I thought I was crazy. I mean, you talk to your doctors about it, but I do know, I know how I feel physically and how it's impacting me and hurting. And so I know that it has that effect of what you're just talking about. And so hopefully now you know too. So either or, there's got to be balance. And the same thing with our diets.
Yes. So Dr. Wiggins mentioning how people can react to certain things around their life, and it's very particular to see these patients that you tell them, okay, you gotta lay off the salt a little bit, and they're like, no, I can't. That is not possible. That is impossible for me. And it just becomes this, okay, well, what are we gonna do about this then? And when we talk about our diet and we focus, well, the number one focus we talk about heart health is sodium intake in our diets. And we think about the salt shaker, that we add the salt to our foods as we're prepping them, as we're eating them. We go out to eat. These plates are packed full of sodium as well. And then processed foods. That's our number one culprit right there. We don't think about that too much. We just think about salt shaker primarily, but that's the number one way we get a lot of sodium in our diet. It's the kind of way we kind of avoid that, especially those canned meats, those deli meats, those heavy processed meats. You get a lot of sodium from that. Dr. Vidal also mentioned very importantly, just being active, being sedentary. You work at an office, you work at a very, laid back kind of style, and you sit all day. You get home, you watch TV, and you sit the rest of the day as well. And you're just increasing your risk for mortality just sitting all day, and it's not helping your heart. Your heart is not getting a workout that it needs. And just starting off, you said like Mayo Clinic, just starting is such a big step.
Diet, we tend to think, we want to lose weight and that sort of thing. And sometimes we just jump into a diet that's not heart healthy at all. And so, I don't want to slam a particular diet, but but sometimes, even just trying to lose weight can probably do just as much damage because we're doing something to our bodies that is not conducive for heart health.
Dr. Wiggins mentioned in the green room the keto diet. And that's one diet that we can have problems sometimes with heart health because they consume a lot of protein, a lot of fat, and it's not just the quantity of fat, it's the quality of the fat. What type of fat is it? Is it coconut oil? Is it olive oil? What are you putting in your body? And you feel like, I'm dieting, I'm doing this great, I'm feeling great, but your heart can suffer sometimes, even when you're following this diet and you're losing weight, which is a great point you bring up, Dee Dee.
Very good. Our producer asked me a really good question for you, Dr. Vidal, and I was just going to try to work it in here, but it's just sticking in the back of my head, and I just got to throw it out here to you.
Okay.
If you're ever diagnosed with heart disease, is there ever an opportunity for this to be reversed? Or is it just something you live with, or you have to maintain?
That's an excellent question.
I know.
So you can reverse some of heart disease. So first of all, you have to have the concept of what are we talking about with heart disease?
Thank you.
I'm thinking of atherosclerosis, which is a word for hardening of the arteries, plaque. It can be in your brain, that causes a stroke. It could be in your legs, that's peripheral vascular disease. If it's in your heart, it's heart disease. If you get your cholesterol low enough, and a lot of times we do use these drugs called statins, and you control your blood pressure, that can reverse or stabilize. But it has been shown that it actually can reverse.
Oh, really?
Yes.
That's good.
It is good.
And of course, with heart attack, you won't know that until that's on you. So the only thing you
Well-
can do is probably more preventing. Tell me, you're the doctor.
No, well,
you're the
I mean,
cardiologist.
I'm almost hesitant to say this, but there is, the primary things is to pay attention to your health and get your blood pressure checked. There is some novel tools out there that doctors are doing, and I'm not trying to sell your listeners, but the President of the United States got this test recently. There's a scan they can do of your heart that we can actually see if plaque is developing in your heart. And we can see it, it's very non-invasive, and it gives you 10-year risk. Wow. And that's the only test we have that actually can predict what your risk is over 10 years. So there is things to go to the doctor and talk about.
Okay.
But I think focusing on the risk factors that you talked about earlier,
okay,
DD,
okay. Is the bigger
is a big thing.
picture. Okay, I gotcha. So now turning back to you, Eddie, tell us some heart healthy foods. You mentioned some things that weren't so healthy. So our viewers leave saying, okay, let me try that. Let me do this. Give us some good
Sure.
examples. Of some
So
heart healthy
number one, fruits and veggies.
Okay.
We talk about it a lot. And we talked about earlier how it's difficult for some people to obtain these fresh fruit and veggies because they are expensive. But research has shown that if you get them frozen, they maintain the same nutritional profile, even better at times, than getting the same fruit fresh because it's getting oxidized as it is just laying out the grocery store, and it's cheaper as well. So that's an option for people that want to incorporate that into their diet. And we always shoot for that 5 a day between veggies and fruit to kind of incorporate, try to get veggies in your lunch and dinners and fruits in all of your meals. So you hit that 5 a day, which is so important for heart health and overall just health as well. And we talked about sodium as well, and I want to touch on saturated fat as well, which is a very big, Dr. Vito mentioned cholesterol levels and how they can rise with the saturated fat intake. In the 80s, we thought it was just cholesterol. We got to stay away from cholesterol high foods. And now research has shown it is actually saturated fat. And then not only saturated fat, but what type of saturated fat? You know, it's what is the matrix of the food that you're eating. And I mentioned coconut oil earlier. That is very high in saturated fat. It's a tropical oil. And it's very trendy nowadays to kind of add that to everything. And for cooking per se, it's just a little bit for cooking. It tolerates heat pretty well, and that's fine every now and again. But there are so many options nowadays. Even avocado oil tolerates high temperatures better than coconut oil. So there's really no excuse to go to coconut oil or palm oil or these very high saturated fats that you can incorporate every day. Red meat as well. That juicy fat, that marbling that those steaks can have sometimes, very high in saturated fat as well, and not very heart healthy. And also whole grains. The Mediterranean diet and the DASH diet, which are two very world-renowned, scientifically sound diets that work to improve cardiovascular health, among other things. And they focus on whole grains, which is something that I got a lot of patients that they have no idea what it is. They're like, is that the brown bread? And you kind of, we have to read labels at this point to kind of discern a little bit and know what we're getting into our bodies. And I find it very curious that sometimes we're very picky with the gas we put into our car, but we don't care what we put into our bodies.
That's true.
And that is not beneficial to us in the slightest. And once you incorporate all these different factors in our diet, so we got whole grains, we got some lean protein with fish and poultry, and just cooking methods as well. Not, fried chicken is so popular.
Bacon.
Yeah, and bacon as well and all that stuff. We can, if you bake it, it's going to be way better.
Okay.
Nowadays, we even have air fryers, which use no oil at all, and you get that crispy flavor that you want with fried chicken. And you can make your own at home, make it a little bit healthier because that seasoning that they use to bread the chicken at most places is just going to be packed full of sodium.
Yeah.
And
I was going to ask you about that. So
Yeah.
when we go out and we're eating out, I mean, what do we do then?
So it's very difficult now. I mean, it's gotten better because now we have nutrition facts labels. You can ask for it at a restaurant. Fast food restaurants have to have it by law as well.
Okay.
So we do have, we've gotten better about it. But just because there's a poster on a corner at a Wendy's, it doesn't mean you're going to look at it.
Right.
So it's just, and then once you go to like a McDonald's, you get a salad and it has the same amount of calories as a hamburger has.
Okay.
And that's not really helpful. And it is very difficult, Dee Dee, to go out and kind of be mindful about what you eat and sodium wise, especially at restaurants. But just kind of shooting for those whole grains. Okay, this plate has a couple veggies in there. It's lean cuts of meat. It's not fried. It's not breaded. Let's go for this one. It doesn't have any refined grains. And that can usually be lead to better outcomes. And also legumes. Eating Hispanic, so I eat a lot of beans, and that's something that has been proven to have so many beneficial.
Now, legumes, are we including like lima beans and
Yes,
other?
lentils,
are we talking about, okay,
all that
lentils,
good stuff. Yes,
okay.
kidney beans, the
Just
red
being
beans, the
silly.
black beans.
Right.
They have a lot of fiber. They have a lot of they get the minerals from the soil,
Sure.
and they can be very cardiovascular protective as well. And Dr. Vido can shed some light on this as well. We do have this kind of Hispanic paradox of Hispanics tend to be more prone to some cardiovascular disease, or at least they should be. But one of the reasons people might think that we have, scientists think that we have a lesser amount of these heart attacks is because we consume so many legumes in our diet, which other populations do not. So even just adding something to your diet you typically do not have can have a big impact on your long-term outcomes.
Okay, very good. Let's talk a little bit about one more question before I leave you, because what came to my mind was herbs and a lot of spices and things
Yes.
like that. Is that helpful for heart health? I mean, anybody can
Yes,
speak.
definitely.
Yeah, okay.
Especially when people say, I can't eat without salt. Okay, well,
Okay.
have you tried herbs and spices? And
Right.
I think the number one barrier with herbs and spices is how to use them. Educating people on, I don't cook that much, so how can I get that fried chicken just right without that salt? And you have to, and there's so much misinformation online as well. And so herbs and spices, fantastic. You can buy some blends, seasoned blends they don't have any added sodium or anything like that to it.
Okay.
And those are, it's so convenient nowadays. Like this seasoning blend for chicken.
Yes.
That's it.
Yes.
Simple. So you don't have to buy all these spices and herbs, have this huge rack
Right.
at your kitchen.
Right.
When you can just get so convenient with it nowadays, and it's very important that you bring that.
I
up.
have
Thank
all
you.
those, I have all those spices, but I still end up with the salt, but anyway, I did want to ask, because when you do look up information about herbs and spices, you do find that there are some that they talk a little bit more about being
Yes.
very healthy for you to eat.
Yeah, sauces
yeah.
also as well, dressings. Even when we eat a salad, but then we pour so much dressing on it that what are we really doing at this point?
Yeah.
Sauce as well tends to be high in sodium. Now you can get sauces without high fructose corn syrup, without so much added sugars. So people are kind of being more conscious about it as well, which is why the new nutrition facts label is changing to have added sugars as well, and kind of have people, okay, this is just buckets full of sugar. Dr. Vido mentioned earlier how we had those reduced fat items or those low fat items, and they just pumped them full of sugar. And it still happens nowadays. People have just gotten a little bit wiser about it and be like, I should really kind of look at the label here, because that's typically what they do. They make it more, it tastes good. Oh, it tastes amazing. Yeah, because they just add a whole bunch of sugar to it, of course. So it's very important for us to read labels, and you go to a grocery store and you don't see people doing that.
It is amazing that if you cut back on your table salt, because we have so much salt in our food naturally, and you go out to eat, you almost can't. You'll send it back to the kitchen.
Right.
It's unbelievable how salty it will taste. I guess after that 100 days of doing that habit, right? The other thing is that you give the cooking classes at Everman's. You go in there, quinoa and all the grains that they have in there are wonderful from what I've read. And I've tried them, but they're very unaffordable. And that's one of the problems here.
Gotcha.
That's an example of the food items that other countries eat that are very healthy, but they're very expensive here.
You mentioned some information that was astounding to me, talking about other countries. You were talking about the numbers in Africa with heart disease. Can you share some of that? Because it just really, even though it's in Africa, it still parlays for African Americans in a lot of ways.
Right. It's the statistics in Africa are that hypertension, first of all, cardiovascular disease is the #1 killer. But the primary focus of our missions here has been to go over and treat HIV. I'm not taking away from that. Malaria, HIV, rheumatic fever is still a disease there. You may not know what that is, but they have a lot of that. But hypertension is a #1 disease there. It's 1 in 2 African Americans over the age of 25. And the concept, as much as we're having difficulty here, the concept that you have to take a pill every day is foreign to most of those countries. And I was shocked to read that statistic.
Oh, yeah. I was going to ask you, too, Dr. Vido, about, I know you can't probably share a lot of information about your cases and things like that, but maybe you may want to tell us about something, a patient or something that you've had to deal with here in the Pensacola area, maybe a situation where somebody either turned around or whether a situation was so bad, and what you all were able to do to help, or tell us about cases.
That is every day.
Okay.
I mean, I say this and it sounds like something a doctor would say. We see miracles every week. We see people that haven't exercised and come in 6 months later, and something clicked. They did something. They couldn't lose weight for 10 years. And all of a sudden they just said, I didn't know if I gave up. Most of the time it's alcohol, I'm afraid. If I didn't go to Hardee's every morning and have that biscuit, and it's amazing, all of a sudden you just see them transform. I'm sure you see that. The other thing is, I just wanted to address Dr. Wiggins, if I could add, that our studies show that people that go through have heart disease, men more than women, 50% are depressed. And if they go to rehab, it's another form of, if they go to exercise, there's 78% reduction in some studies of depression, or whatever testing you guys do. And it's just amazing how exercise and eating right treats your depression or how you feel about yourself.
It really can. And I want to go back to what you mentioned before, because you mentioned like your own experience of having had some experiences with trauma and then working out, and at times maybe perhaps confusing an increased heart rate for anxiety. That's not uncommon. So there is a term in psychology called interoceptive awareness, and this happens for people that have panic disorders or panic attacks. And so they experience the same things that other people experience whenever they're exercising, so an increase in heart rate, sweating, and things like that. But because of their experience of panic disorder, they are confusing those cues with anxiety and panic. And so they've made this association, and so they feel afraid to exercise because it reminds them of what it feels like to have a panic attack.
Exactly.
Yeah.
That's exactly what it is. Thank you for putting it into words.
So there are things that you can do. There's free apps out there that you can download that teach you deep breathing exercises. There's a technique called 4-2-4 where you inhale for 4 seconds, hold your breath for 2 seconds, then exhale for 4 seconds. One of the things that happens for people when they're panicking is that they're inhaling more than they're exhaling. So they forget to exhale. I see this in therapy all the time, where I have to remind clients whenever they're really emotional, I'll say, okay, exhale, you're holding your breath, because you don't know that you're doing it because you're panicking. And so it's physiologically impossible to have a panic attack whenever you are engaging in deep breathing exercises. And so there are things that you can do to teach yourself to, have positive associations with exercise instead of having those negative associations with exercise.
Okay, very good. Who's stressing more, men or women?
Well, women are more likely to seek treatment.
Okay.
They're more likely to be seen in treatment. But I'd say that it's probably pretty bad for both. Depending on the disorder. So for instance, like depression, it looks very different in men than in women. And so a lot of times women have the very classical presentation of depression. So the depressed mood, maybe difficulty concentrating or staying on task, some type of insomnia, eating difficulty, things like that. And men, a lot of times, they'll assume that they have an anger management issue. So they'll come in and they'll say, I have issues controlling my anger. And after meeting with them for a few sessions, like, no, you're not. You don't have anger management, you're depressed. But it's just more socially acceptable for men to report feeling angry than it is for them to report feeling sad. And for some men, they've been so socialized to not acknowledge their sadness that they don't even realize that they're sad. They really just think they're angry. right? But anger really is a secondary emotion. It's the easiest feeling to express. And sadness, hurt, those are much more vulnerable emotions that women are much more likely to express. And so a lot of times, you know, a man who has these anger management issues is not going to go to therapy. And if he does, it could be overlooked as an anger management issue and he's really depressed or anxious.
Okay, gotcha. And just zipping over to the stress, back to the stress factor. We can just say stop stressing, but that's not.
It's not going to work.
That's
it's
not
like
going to
yelling
work.
at somebody to calm down when they're, you know, when they're in
Right.
crisis. If you say calm down, the last thing the person's going to do, oh, okay, I'll be calm now. You know, you sort of have to model for them. Okay, you know, you use the tone of voice. But yeah, so telling someone to stop stressing out is probably one of the worst pieces of advice that you could give them. People really just want to be heard. Honestly, all people want is validation, and they want their problems to be normalized. People want to believe that they're not alone and they're not crazy. And so it almost feels counterintuitive, but when I'm doing couples therapy or group counseling, what I'm teaching people how to do is to do that. So we're socialized to give people advice, unsolicited advice, which nobody wants. I've never met somebody that's like looking for unsolicited advice.
Right.
Most people just want to know that you understand, that there's somebody that cares about them. And so it feels like in couples, a lot of times I'll have, you know, couples like have this cyclical argument because, you know, for instance, I might have a female client say, he's always trying to fix it. I don't want him to fix it. I just want him to listen. That's what people want.
I just want him to recognize that it's
I
broken.
just want him to recognize but then, you know, the male partner might be like, but that doesn't seem like enough. Like, I feel like I'm supposed to fix it, but sometimes just acknowledging, oh, I can tell that you're hurt. I can tell you feel anxious. Oh, this is a stressful point in your life. You know, sometimes when people have these really happy things happen in their life and they have this stress reaction, they hide that stress reaction from their families or their friends because they feel ashamed about feeling stressed, about, you know, having good things happen in their life. When if they could tell someone that I'm feeling stressed and the person says, hey, makes sense. You're in a
And
traditional,
all of those stressors
right.
are cumulative, leading to all the
Right.
problems associated with heart disease.
Yes.
Yeah.
And
I did
ahead.
want to add one thing. When we were talking about stress, that was I learned a lot.
very interesting.
But I do want to say that I had to do a talk one time for Valentine's Day, and we're talking about depression. Love also decreases the risk of heart disease. And I don't know if it's love a male or a female, but that does too, but that's a little stressful at times. But a pet, even people that have a pet have less heart attacks, and that has been shown.
I love that.
yes.
How often do you hear about couples that have, it seems like the couples stay married and happy and they live longer than people who are single? I mean, I don't know.
No,
So
if you lose a spouse, the year after you lose a spouse is a very high risk of having a cardiovascular event.
And if you live alone, you're 80% more likely to be depressed.
Wow, see,
know?
boom, it's all going back together again.
Yeah, it is.
But I love that, Dr. Vito,
Wow.
that you say love because it
It's a
just
very important
covers
medicine.
a lot. Yes, a very big, important ingredient in life and in medicine. Before we wrap up here, again, want to reiterate, because I don't want you to leave the way you came, want to reiterate some of the factors that would help us reduce any type of stress, and with heart disease, anything that would cause for a reduction. And let's bring up that screen and we just go through these right quick. Quit or don't start smoking. Exercise regularly. Maintain a healthy weight. Eat a healthy diet. Anything else?
You know
Mike?
what?
Thank you so much.
There's one in here. Oh,
Go. It's on you.
Sleep
Sleep.
Yeah.
is the number one medicine for everything.
Love it.
It really is. Everything doesn't work. Your blood pressure goes up. Sleep apnea leads to impotency problems for men, diabetes, whatever. Everything you've heard, sleep is very important. And it's amazing to me how many women have poor sleep hygiene. Men too, but women particular a lot are waking up at 3 a.m, can't go back to bed.
Right here.
I know.
I had
Yeah, and
medication for it for the longest, but I
Right.
tried to stop, because I didn't want to be on it.
A
But
really effective form of treatment for insomnia is CBTI. It's cognitive behavioral therapy for insomnia. These are clinicians that are trained to treat people with this manualized treatment, and it's more effective than drugs
I love
for
this.
insomnia.
Boy, I've learned a lot here.
Haven't we all?
Oh, yes. We have less than 3 minutes left. I want to give each of you an opportunity to just give us a closing thought.
The public health person in me says, prevention is going to not take away the rest of the jobs, but it certainly is going to reduce the risk. You can control some risk factors.
Very good.
When you look at everything we talked about, it's overwhelming to most people, and they will fail if they sit here and focus on every 8 things. Take one thing, live a healthy life, make good decisions, but do everything in moderation. Just because you go out to gallery night and have a great time and eat a big dinner, the next day, jump back in the saddle.
I love this.
Really
Eddie?
good. I think it mentioned Mayo, you put up, eat a healthy diet, and you put up all these risk factors, and people think about, I need to get on a diet. Diet is what we eat every day. But I think just leading a healthy lifestyle, you have to kind of change the way you look at things a little bit. And Dr. Vito mentioned it, you have to take one thing at a time, and you have to find what works for you. Everybody's a little bit different, but you have to find what works for you.
I love it a lot.
I think a little self-compassion goes a really long way. I think when you really care about someone, you make sure that you don't hurt them, that you do things that you're there for them, that you're supportive of them. And I think it's important that people find ways to do that for themselves.
Self-compassion in moderation, love, sleep.
Yeah.
Yeah, I love it all. And an ounce of prevention is always worth a pound of cure. Thank you all for being here on The Aware Show and sharing all this great information. We all have learned something, even here on the panel, and I know that our guests there who've been watching the show have learned a lot as well, and that's what we want to do here on The Aware Show. And another thing that I just want to leave our viewers with is to remind them that some of the questions that came from panelists that you've had before with the links, and it came from some of the audience discussion. So I feel like, although we've had an opportunity to talk here tonight and learn a little bit more about heart health, I feel like the audience who came up with some of those questions and the audience out there now got some of their questions answered. And that's what it's all about here on The Aware Show. Thank you for giving of your time and your talents and your gifting and your expertise to give us a little bit of what we need to know about keeping a good heart health, and guarding our hearts. Thank each of you for being here on the show.
Thanks for having us, Dee Dee.
Thank you. That's all the time we have for now. And if you would like more information about the Links Incorporated, you can contact them from the bulletin board that's going to be shown here on your screen. We'd also like to thank the Links Incorporated and all of our guests. Special thanks to our friends at Baptist Healthcare who provided some of our panelists here. And as always, thank you for joining us here on the Aware Show. Becoming aware of symptoms and risk unique to women, eating a heart-healthy diet, exercising, and letting go or reducing stress can help protect you and your heart. Hopefully, we've made you aware of how to prevent heart disease, embrace a healthy lifestyle, and improve your quality of life. Be sure to catch this and some of our favorite past Aware shows on YouTube or just here at WSRE.org. Until the next time, I'm Dee Dee Sharp saying, stay informed and stay aware.